Picture this moment. You are getting dressed in the morning and you notice your ankles look puffy. They have been that way for a few days, but you told yourself it was just standing too long, or the heat, or nothing really. You have been waking up 2 or 3 times a night to use the bathroom, more than you used to, but you put it down to getting older. Your urine looked darker than usual last week, just once, and it passed, so you let it pass with it. And there has been this low, persistent ache in your lower back, just behind your ribs, that comes and goes. Nothing dramatic, nothing sharp enough to call anyone about. You have been telling yourself these things don't mean anything, but here is what your kidneys may be trying to tell you. And here is why that quiet dismissal, repeated enough times, across enough symptoms, becomes one of the most costly decisions an older adult can make about their own health. The kidneys are among the most silent organs in the human body. They do not produce pain the way an inflamed appendix does. They do not stop working all at once in a way that demands immediate attention. They decline gradually, over months and years, sending signals that are easy to dismiss, easy to attribute to aging, easy to let slide, until the moment a blood test comes back with numbers that finally cannot be ignored. And by then, significant and irreversible damage has often already occurred. I'm Dr. Naira Stein, your seniors health and wellness consultant. If you are over 60, and especially if you have high blood pressure, diabetes, or a family history of kidney disease, what I am about to share with you is not academic information. It is the kind of precise, practical knowledge that can be the difference between catching a problem early when it is still highly manageable and discovering it late when the options are far more limited. We are going to walk through 5 kidney warning signs that adults over 60 should never dismiss, never delay acting on, and never explain away without a medical evaluation. I will tell you exactly what each sign means, why it occurs, what it is telling you about what may be happening inside your kidneys, and what you should do the moment you recognize it. Stay with me. This conversation matters. Why the kidneys go silent, and why that silence is dangerous. To understand why kidney disease so frequently goes undetected until it is advanced, you need to understand something fundamental about how the kidneys are designed. Each kidney contains approximately 1 million nephrons, microscopic filtering units that are the working cells of kidney function. Each nephron consists of a knot of capillaries called the glomerulus, surrounded by a tube that processes the filtered fluid, reclaims what the body needs, and sends waste toward the urine. These nephrons operate with extraordinary redundancy. The kidneys have far more filtering capacity than the body actually needs under normal resting conditions, a reserve built in by nature as a buffer against damage and disease. The consequence of this redundancy is that kidney disease can progress through the loss of hundreds of thousands of nephrons, reducing filtration capacity by 30, 40, even 50% before the remaining nephrons, compensating by increasing their individual workload, begin to show strain in standard blood tests. Creatinine may remain within normal range. The eGFR may look acceptable, and the person feels, in all honesty, largely fine. This is the dangerous window, the period when damage is accumulating faster than standard monitoring can detect it, and when the body is beginning to generate signals that are real and meaningful, but are not yet obvious enough to demand attention. Learning to recognize these early signals and to take them seriously is the entire point of today's conversation. After the age of 40, kidney filtration capacity declines at approximately 1% per year. By 65, most adults have lost 20 to 30% of the kidney function they had at their peak. By 75, that loss may approach 40% or more. This age-related decline is not disease, but it dramatically narrows the margin of safety. A kidney that is already operating at 65% of peak capacity has far less tolerance for the additional insults of hypertension, blood sugar fluctuations, dehydration, nephrotoxic medications, or infections than a kidney operating at full reserve. The early warning signs of stress that the body generates in this state deserve a fundamentally different level of attention than they would in a younger adult. What might be a minor and transient signal in a 30-year-old is a meaningful and urgent message in a 65-year-old with reduced kidney reserve and coexisting medical conditions. The same signal, the same symptom, very different implications. Why symptoms appear when they do. Kidney disease symptoms emerge through two distinct mechanisms. The first is the direct effect of reduced filtration. When the kidneys cannot clear waste products efficiently, those waste products accumulate in the blood and tissues, producing symptoms that reflect the body's chemical imbalance. The second is the indirect effect of the kidney's broader regulatory role. Because the kidneys regulate blood pressure, fluid balance, electrolytes, red blood cell production, and vitamin D activation, failure in any of these functions produces its own constellation of symptoms that may not obviously point to the kidneys at all. This is precisely why kidney disease is so frequently misattributed. Fatigue gets explained as poor sleep. Swelling gets attributed to standing too long. Changes in urine get normalized as just aging. Breathlessness gets blamed on being out of shape. Each symptom, viewed in isolation and with no knowledge of what it might represent, looks entirely unremarkable. Viewed together, and viewed through the lens of what the kidneys do and what happens when they struggle, they form a picture that is anything but unremarkable, a picture that deserves immediate expert attention. Let me walk you through each of the 5 warning signs in exactly that detail. The 5 kidney warning signs. Never ignore these after 60. Before we begin, I want to be precise about one thing. The presence of any single one of these signs does not confirm kidney disease. Many have multiple possible causes. But in adults over 60, particularly those with risk factors including high blood pressure, diabetes, a history of urinary tract infections, or a family history of kidney disease, any one of these signs warrants a prompt and serious conversation with your physician. The appropriate response is never to wait and see. It is to know and to act on what you know. Swelling in the legs, ankles, feet, or around the eyes. Of all the signs on this list, swelling, what physicians call edema, is perhaps the one most people encounter and most consistently explain away. And it is one of the most important to understand correctly. The kidneys play a central and irreplaceable role in the body's fluid balance. Every day, they regulate the volume of fluid in the bloodstream and tissues by controlling how much water and sodium the body retains or excretes. When kidney function declines, this regulation becomes impaired. Sodium accumulates, water follows sodium, and the result is fluid retention, excess fluid that settles in the body's tissues, most visibly in the lower extremities where gravity concentrates it. Swelling in the ankles, feet, and lower legs that is present in the morning, not just after a long day on your feet, is particularly significant. Morning edema is not positional. It does not reflect gravity's work over a day of standing. It reflects fluid that has accumulated in the tissues overnight, when the body should have had ample opportunity to redistribute and clear it. When morning swelling is present consistently, it is a signal that the kidneys are not managing fluid balance adequately, and that deserves immediate evaluation. Periorbital edema, swelling around the eyes, particularly noticeable in the morning, is another kidney-specific warning sign that carries particular weight. This occurs when protein is leaking from the bloodstream into the urine, a condition called proteinuria, reducing the osmotic pressure that normally keeps fluid within blood vessels. Without adequate protein in the blood, fluid seeps into surrounding tissue. The eyes, with their loose and mobile surrounding tissue, are one of the first places this manifests visibly. In advanced kidney disease, fluid can also accumulate around the lungs, causing breathlessness when lying flat, or a persistent sense of not being able to take a deep enough breath. If swelling is accompanied by any respiratory symptoms, the urgency of seeking medical evaluation is even higher. The distinction that matters most is between swelling that is transient and positional, the ankles that swell on a hot day after standing for hours and are normal by morning, versus swelling that is persistent, present at rest, bilateral, and worse in the morning. The former may require attention but is rarely urgent. The latter, in an adult over 60, requires prompt medical evaluation. Press firmly on the swollen area for 5 seconds and release. If your fingertip leaves a visible dent that takes several seconds to fill back in, this is called pitting edema. It indicates significant fluid accumulation in the tissue. Pitting edema in an adult over 60 with any known health conditions warrants a same-week physician appointment, not a wait-and-see approach. Swelling is sudden and severe, involves the face and hands as well as the legs, is accompanied by shortness of breath, chest pain, or extreme fatigue. These may indicate an acute kidney injury or cardiac event requiring emergency evaluation. Changes in urination, frequency, color, foam, or blood. The urine is, in a very literal sense, the output of your kidney's daily work. Every characteristic of your urine, its color, its clarity, its frequency, its volume, whether it foams, whether it contains blood, reflects something about what is happening inside those filtering units. Learning to read these signals is one of the most direct and actionable things an older adult can do for their kidney health. Let us go through the specific changes that matter most. Foamy or frothy urine. When urine foams persistently, a froth that sits in the toilet bowl rather than dissipating quickly, it is almost always indicating the presence of protein in the urine. Under normal circumstances, the glomerular filtering barrier is too tight to allow large protein molecules to pass into the urine. When the glomeruli are damaged by hypertension, diabetes, autoimmune disease, or progressive kidney disease, this barrier breaks down and protein begins to leak through. Protein in the urine, proteinuria, is one of the earliest and most sensitive markers of kidney damage available. It often appears before creatinine begins to rise and before eGFR shows significant decline. A single urine test, the albumin to creatinine ratio, can detect it. Many older adults with significant proteinuria have never had this test. Occasional mild foaming of urine is normal and may simply reflect concentrated urine or fast urinary stream. Persistent foaming, present across multiple bathroom visits over multiple days, is not. It warrants a urine test as soon as possible. Blood in the urine, visible or microscopic. Visible blood in the urine, hematuria, is one of the clearest calls to immediate action that the body can produce. Urine that appears pink, red, brown, or tea-colored should prompt a same-day call to a physician, or, if accompanied by pain, fever, or systemic symptoms, a visit to an emergency department. The causes of hematuria in older adults range from relatively benign, a urinary tract infection, a kidney stone, to conditions requiring urgent investigation, including bladder cancer, kidney cancer, or acute glomerulonephritis. There is no way to distinguish between these causes based on appearance alone. Every episode of visible hematuria in an adult over 60 requires professional evaluation, and no episode should be dismissed as probably nothing. Equally important, and more commonly overlooked, is microscopic hematuria, blood in the urine that is too small in quantity to be visible, but detectable on a routine urine dipstick test. Microscopic hematuria discovered incidentally on a routine test is often not followed up adequately, yet it can be an early marker of significant kidney pathology. Ask your physician what to do if blood is detected on any urine test you receive. Changes in urinary frequency, especially at night. Needing to urinate more frequently, particularly at night, a symptom called nocturia, is extremely common in older adults and is frequently attributed to a benign enlarged prostate in men, or to bladder changes in women, or simply to aging. These explanations are sometimes correct, but nocturia can also be an early and significant sign of reduced kidney concentrating ability. Healthy kidneys are able to produce concentrated urine at night, reducing urine volume and allowing uninterrupted sleep. As kidney function declines, this concentrating ability is one of the first capacities affected. The kidneys begin producing more dilute urine and more of it, requiring more frequent voiding. Waking 3 or more times per night to urinate, particularly if this represents a change from your previous pattern, deserves a conversation with your physician that specifically includes consideration of kidney function. Conversely, producing much less urine than usual, or no urine at all for an extended period, is a sign of acute kidney injury that requires emergency evaluation without delay. Persistent foamy urine across multiple days, any visible blood or color change in urine, a significant increase in nighttime urination compared to your normal pattern, or a sudden dramatic decrease in urine output. Any of these warrants a physician contact within 24 to 48 hours, or sooner if accompanied by other symptoms. Warning sign 03. Persistent fatigue and unexplained weakness. This is the warning sign that is most universally attributed to something else: stress, age, disrupted sleep, depression, overexertion, and therefore the one most consistently and dangerously underinvestigated in older adults. The kidneys produce a hormone called erythropoietin, EPO, which signals the bone marrow to produce red blood cells. Red blood cells carry oxygen from the lungs to every tissue in the body. When kidney function declines, EPO production falls. Red blood cell production drops. Hemoglobin levels decrease. And the result is a form of anemia, called anemia of chronic kidney disease, that produces a quality of fatigue quite distinct from ordinary tiredness. The fatigue of kidney-related anemia is not the tiredness of a bad night's sleep that resolves with rest. It is a deep, persistent heaviness, a bone-level exhaustion that is present in the morning despite adequate sleep, that worsens with minimal physical activity, and that tends to escalate over weeks and months rather than coming and going. It is often accompanied by breathlessness on mild exertion, climbing a single flight of stairs, carrying light groceries, because the blood simply cannot carry enough oxygen to meet the tissue's demands. Cognitive changes frequently accompany this form of fatigue. Difficulty concentrating, a sense of mental fog or slowness, reduced motivation, and what patients frequently describe as not feeling sharp are all consequences of reduced oxygen delivery to the brain. In older adults, these cognitive symptoms are routinely attributed to aging, depression, or dementia, when in fact, they may reflect a treatable and specifically kidney-related anemia. There is also the matter of waste product accumulation. When the kidneys are not filtering effectively, urea and other nitrogen-containing waste products accumulate in the blood, a condition called uremia. Even at subclinical levels, uremia produces fatigue, cognitive impairment, nausea, and a general sense of unwellness. These symptoms are the body signaling that the chemical balance of the blood is shifting, that the internal environment the cells depend on is becoming increasingly compromised. The combination of fatigue and any of the other warning signs in this list should dramatically lower the threshold for seeking medical evaluation. But even in isolation, fatigue that is disproportionate, persistent, and unexplained by obvious cause in an adult over 60 with cardiovascular risk factors warrants a blood test that specifically includes kidney function markers and a full blood count. Request a full blood count alongside your kidney function tests. If anemia is present alongside elevated creatinine or reduced eGFR, the two findings together paint a significantly clearer picture of kidney involvement than either finding alone. Warning sign 04. Persistent back or flank pain below the rib cage. The kidneys sit in the posterior abdomen, tucked beneath the lower ribs on either side of the spine, in the area anatomists call the flank. Pain originating from the kidney region has a characteristic location and quality that distinguishes it from the more common musculoskeletal back pain that most adults over 60 experience periodically. Kidney pain is typically felt on one or both sides of the back, just below the last rib, and may extend around toward the front of the abdomen or down toward the groin. It is often described as a deep, dull ache rather than a sharp or positional pain. Unlike musculoskeletal back pain, kidney pain does not tend to worsen with specific movements, bending, twisting, or stretching, and is not relieved by changing position or lying down. It is also often accompanied by other urinary symptoms, changes in urine color, frequency, or volume. The causes of kidney pain in older adults encompass a spectrum of urgency. Kidney infections, pyelonephritis, produce pain in the flank that is often accompanied by fever, chills, nausea, and urinary symptoms. This is a serious condition requiring prompt antibiotic treatment, and untreated kidney infections can cause acute kidney injury and permanent kidney scarring. Kidney stones produce pain of a very different character, typically severe, cramping, and colicky, often radiating from the flank down toward the groin and frequently accompanied by nausea and visible blood in the urine. Kidney stone pain is among the most severe acute pain experiences documented in medicine and is unlikely to be confused with something minor. But smaller stones may produce a persistent, dull flank ache without the dramatic colicky episode, and these can be overlooked. Polycystic kidney disease, a genetic condition in which cysts grow on and within the kidneys, progressively replacing functional tissue, can produce flank pain or a sense of fullness or heaviness in the abdominal or flank region as cysts enlarge. Many people with polycystic kidney disease are not diagnosed until their 40s, 50s, or 60s, when cysts have grown large enough to produce symptoms, or when declining kidney function appears on routine testing. Perhaps most concerning, kidney tumors can cause flank pain, sometimes accompanied by blood in the urine and a palpable mass. Renal cell carcinoma, the most common form of kidney cancer, is predominantly a disease of older adults, with peak incidence between 60 and 70. It is frequently silent in its early stages, making the appearance of pain or hematuria in this age group particularly important to investigate without delay. The critical principle with flank or kidney region pain is this: back pain that is positional, associated with muscle tension, and improves with movement, rest, or simple analgesia is likely musculoskeletal. Back pain that is persistent, not clearly positional, located in the flank below the ribs, and accompanied by any urinary symptom or systemic signs like fever, chills, or unexplained weight loss, requires kidney evaluation. The location and accompanying features matter more than the intensity. Flank pain is severe and comes in waves, is accompanied by fever above 38 degrees Celsius, is associated with visible blood in the urine, or is accompanied by vomiting or inability to keep fluids down. These signs together suggest a kidney infection or obstructing stone that requires prompt medical assessment. not a next available appointment, but urgent care within hours. Warning sign 05. Uncontrolled high blood pressure despite medication. This final warning sign is perhaps the most clinically complex and the one most likely to be missed, precisely because it appears to be about something other than the kidneys entirely. The relationship between the kidneys and blood pressure is one of the most tightly integrated feedback loops in human physiology. The kidneys regulate blood pressure through multiple mechanisms, controlling fluid and sodium balance, secreting a hormone called renin that activates a chain of reactions raising blood pressure, and producing compounds that regulate vascular tone. And blood pressure, in turn, directly and powerfully affects the health of the kidney's glomerular capillaries. This bidirectional relationship creates a cycle that, once established, can become self-reinforcing. High blood pressure damages the glomeruli, reducing their filtration capacity. Damaged kidneys lose their ability to regulate blood pressure effectively, causing it to rise further. Rising blood pressure causes more glomerular damage, and the cycle tightens, progressing toward kidney failure unless the loop is interrupted with appropriate treatment. The warning sign to watch for is blood pressure that was previously controlled on medication and is now drifting upward, or blood pressure that requires increasing doses, additional medications, or combinations of agents to achieve the same control that a single drug previously provided. This pattern of resistant or progressively worsening hypertension, particularly in an adult over 60 with no other obvious explanation, is one of the most important clinical signals of declining kidney function available. Renovascular hypertension, high blood pressure caused by narrowing of the arteries supplying the kidneys, is another cause that specifically affects older adults, particularly those with widespread atherosclerosis. When the kidney's own blood supply is compromised, the organ interprets this as low blood flow and activates the renin-angiotensin system at maximum capacity, driving blood pressure to dangerous levels. This condition is frequently treatable with revascularization procedures or specific medications, but requires kidney imaging for diagnosis. Secondary hypertension. Blood pressure elevation caused by an underlying disease rather than idiopathic essential hypertension accounts for a greater proportion of hypertension cases than most people realize, particularly in older adults. Kidney disease is the most common cause of secondary hypertension. If your blood pressure has become harder to control, if it was previously stable and has shifted upward, or if multiple medications are no longer achieving adequate targets, kidney function should be specifically and promptly evaluated. There is a practical and immediately actionable point here that extends beyond medical evaluation. Blood pressure monitoring at home, using a validated upper arm blood pressure cuff, checked at consistent times with readings recorded, gives both you and your physician far more useful information than an occasional clinic measurement. Blood pressure that appears controlled at appointments but is elevated at home, a phenomenon called masked hypertension, is associated with significantly higher rates of kidney damage than clinic measurements alone would suggest. If you are over 60 with any kidney concern, home blood pressure monitoring is not optional. It is essential information. For adults with chronic kidney disease, most nephrology guidelines recommend a blood pressure target of 130/80 millimeters of mercury or lower. For those with proteinuria, protein in the urine, the evidence for tighter control is even stronger. Discuss your specific target with your physician and monitor at home consistently enough to know whether you are reaching it. Your blood pressure reads 180/110 or higher on 2 consecutive measurements taken 10 minutes apart, particularly if accompanied by severe headache, visual changes, chest pain, or confusion. This is a hypertensive crisis requiring emergency medical evaluation without delay. What to do when you recognize a warning sign. Your action plan. Step 1. Do not wait for it to go away. I want to address the most common response to the warning signs we have discussed, and it is the response that causes the most preventable harm. The most common response is to wait, to observe the symptom for another week, to see if the swelling resolves, to check whether the foamy urine was a one-off, to attribute the fatigue to poor sleep and give it more time, to decide that the backache isn't bad enough to bother a doctor about. In kidney disease, waiting is a form of action, and almost always the wrong one. Every week of unaddressed progression is nephrons lost permanently. Every month of uncontrolled hypertension or blood sugar is additional glomerular scarring that does not reverse. The kidneys do not have the regenerative capacity of the liver. Damage accumulates, and the window in which intervention can meaningfully change the outcome gradually closes. The correct response to any of the 5 warning signs we have discussed, particularly in an adult over 60 with known cardiovascular or metabolic risk factors, is to contact your physician promptly. Not urgently in every case, but promptly, within 48 to 72 hours for concerning but non-emergency symptoms. The same day or immediately for symptoms that indicate potential acute injury, severe pain, blood in the urine, sudden extreme swelling, or blood pressure above 180/110. Step 2. Know what to ask for. When you contact your physician, being specific about what you are concerned about and what tests you are requesting makes the conversation more productive and reduces the chance that your symptoms are normalized away without investigation. The core set of kidney-specific tests that should be requested include serum creatinine and eGFR, which together give the clearest picture of current filtration capacity, urine albumin to creatinine ratio, which detects protein leaking into the urine, often the earliest marker of glomerular damage, a full blood count, which reveals whether anemia is present and at what severity, blood pressure, measured accurately at the appointment and ideally compared against home readings, and electrolytes, including potassium, sodium, and bicarbonate, which reflect the kidney's regulatory function. If you have been experiencing flank pain, visible blood in the urine, or recurrent urinary tract infections, ask specifically whether kidney imaging, an ultrasound or CT scan, is indicated. Imaging provides information about kidney structure, size, and the presence of stones, cysts, or masses that blood and urine tests cannot reveal. Step 3. Build a relationship with your numbers. One of the most empowering things an adult over 60 with any kidney concern can do is to know their own kidney numbers, not just at a single point in time, but over time as a trajectory. A single creatinine reading tells you where you are today. A series of readings over 1, 2, 3 years tells you whether kidney function is stable, declining slowly, or declining rapidly. Information that profoundly shapes both the clinical response and the lifestyle adjustments that are most urgently needed. Request copies of your lab results. Keep a simple record, a spreadsheet, a notebook, a notes app, of your creatinine, eGFR, urine protein, and blood pressure at each measurement. Share this record with every physician who sees you. Be an active participant in monitoring your own kidney trajectory. Patients who understand their numbers, ask informed questions, and track trends over time consistently achieve better outcomes than those who leave all of this to their care team. Step 4. Act on the modifiable risk factors immediately. While waiting for medical evaluation of a warning sign, and certainly in the days and weeks that follow a concerning appointment, there are actions you can begin immediately that reduce the burden on struggling kidneys without requiring any prescription. Hydrate adequately. Kidney function depends on blood flow, and blood flow depends on fluid volume. 6 to 8 glasses of plain water daily, more in warm weather or following exercise, maintains the flow the kidneys need to filter effectively. Stop all non-essential NSAIDs, ibuprofen, naproxen, and related drugs, which reduce kidney blood flow and can acutely worsen function. Reduce sodium dramatically. Less than 1,500 milligrams per day supports blood pressure control and reduces glomerular stress. Bring blood sugar under the tightest control your current management allows. And sleep. Adequate, consistent sleep supports the body's broader repair processes and the hormonal regulation that kidney function depends on. None of these actions replace medical care, but they create the conditions in which the kidneys have the best possible chance of stabilizing rather than declining further in the period between recognizing a warning sign and receiving a definitive evaluation. If you have diabetes, high blood pressure, a family member with kidney disease, a history of recurrent kidney infections or kidney stones, or if you have been taking NSAIDs or certain other medications long-term, your risk of kidney disease is significantly elevated above average, and any of the 5 warning signs should prompt immediate rather than delayed action. Every one of the 5 warning signs we have walked through today is the body attempting to communicate something important. Swelling that says, "My fluid balance is failing." Urine changes that say, "My filters are damaged." Fatigue that says, "I am not producing enough oxygen-carrying cells." Flank pain that says, "Something is wrong in the region of my kidneys." Blood pressure that refuses to cooperate that says, "My kidneys are in a cycle I cannot break alone." These are not random events. They are not simply the inevitable inconveniences of growing older. They are signals from a system that has been working faithfully for decades and is asking, in the only language it has available, for attention. The only question that matters after watching this, is whether you will listen. Not with panic, not with catastrophizing, but with the calm, clear-eyed decisiveness of someone who understands that early action in kidney disease is not an overreaction. It is the single most effective intervention available. It is the difference between managing a problem and inheriting one that can no longer be managed. You now know what to look for. You know what each sign means. You know what to ask for and when to act. You have everything you need to take this knowledge from this screen into your actual life, into your next conversation with your physician, into your next blood test, into the way you pay attention to your own body from this moment forward. The kidneys are quiet organs. They do not demand your attention, but they deserve it. And now, armed with this understanding, you are in a position to give it to them before the silence becomes irreversible. I'm Dr. Naira Stein, and I am genuinely grateful you took the time to be here for this conversation. Look after your kidneys. Act early, and please do not ignore the signs.